Hey everyone, my name is Melanie Grant and this is C&M Glass. Today our topic is our class 2021 PCS Coding for Learning Module 2. This is going to be a brief video talking a little bit about chapters 21 and 25. So by now you should have already looked through some of the first chapters that were assigned, discussing to you about the structure and format about PCS coding. I haven't had a lot of questions this week except for access to certain things in the modules. But as you're starting to go into the chapters very specifically, if you run into anything that doesn't make sense, make sure to send me an email and I'll talk about it either during one of these visits or in our Coding with Ms. Melanie segment. That being said, before we get started, there's a little bit of information about hard due dates. Our hard due dates for our modules are sections where the first couple of weeks will be due. The idea is that all of your book work, which is assigned throughout the week, has a hard due date. So you need to make sure that you've completed all of the assigned tasks and assignments by that due date. For section 1, that's at the end of module 3, which is next week. For those of you that haven't gotten started, I highly suggest not letting that pass till the last minute, because the idea is to work each week on the assigned tasks and put aside any that you have questions on until you have a chance to review with me. You do have an exam this module for your previous module, so make sure you study for that, and let me know if you run into any issues along the way. Okay, so this week we're talking about some of our special sections, which is part of our section 1 of this course for special areas of coding with PCS. These are things that are not medical surgeries, not surgical related. And so we have a slew of items here. These are a little easier than other coding sections. So I wanted to go over them first to get your hands kind of used to going through the book and your feet wet. All right, so this week we're talking about facility-based rehab, physical rehab, diagnostic audiology, which falls under F, mental health services, substance abuse treatments, and new technology, meaning it wasn't found elsewhere, placement, administration, and the differences between measurement and monitoring. Each one of these has its own table with specific breakdowns of root operations that are kind of unique to their section, so that's why we wanted to start there first. You have all of your chapter assignments due by that hard due date, but don't forget to do your discussion no later than Friday of this week with the responses by Monday, and all of your instructor-specific assignments due on Monday. All right, so let's get started. The first thing in chapter 21 is placement, administration, and measurement and monitoring. And so you have 3 different categories here for chapter 21. That's 2, 3, and 4. Okay. For placement, this is something. This is the charge for placing an actual device. So placement. Whereas administration is giving something to the patient. Such as an injection, and measurement and monitoring. These are things like your EKG testing and various different procedures to kind of see how a patient's doing after a certain period of time on, say, a medication or another service to see where they're at. Okay, so to get started, some of the common root operations used in these are anatomical regions and orifices. Keep that in mind. We have here on our PCS expert, each one of these has its own table in the beginning. And with these sections, I really like to use those tables to start with instead of alphabetical. So the important thing to do is to first determine, is my service a surgery, or does it go under one of these special sections? And if so, which one? Okay, so we'll start with placement. And what I like to do is I'll go into my ICD-10 PCS code book under our section that starts with 2 for placement. And that's all the way in the back of your book after all of your medical surgical sections, starting with the number 2. So if you think, okay, well, 0 is medical and surgical, which is 90% of the book. Obstetrics start at 1, and then administration is following that at, placement is following that at 2. So here in my book, which I have the 2018 ICD-10 PCS Expert Edition, I am on page 677. Okay, some important things to be aware of when you're in here. Sometimes you will have tables repeating themselves with different information that start the same characters but maybe are a little different or extended from where you were at before. It's important to always read up and down at all of the tables in PCS to make sure you have the right code selected. And here our tables extend with the option of 2W0 and 2YF on 677. 2W0 is continued on 678. 2W1 and 2W2 then continue past that. 2W3, 2W4, and 2W5. Okay, so for placement, oh, and then on the next page we have 2W6 and 2W0, or I'm sorry, 2Y0, 2Y4, 2Y5, okay? And so the important thing is to say, first off, is it placement to an anatomical region, or is it placement to an orifice? And so when you think of orifice, think of all of the holes in the body, okay? So on the very front, under 677, you have with pink headings where it talks to you about all the different root operations for anatomical regions, and it tells you you have the option of change, compression, dressing, immobilization, packing, removal, and traction. And then under orifice, you have changing, packing, and removal. So it's pretty easy to identify just from this first piece, where am I going and what am I looking for? And I can determine the root operation and then the location based off of what's on here on this very first table. This is something that's unique. It's with the pink lining here, and it really gives us an easier way to code from our tables than having to put the entire code together. Okay? So let's go ahead and look at an example together. Here we have our root operation for change, okay? And now the definition of change is to take out or off a device from a body region and put it back an identical or similar device in or on the same body region without changing or without cutting or puncturing the skin or mucous membrane. Okay, so they're able to go in and change whatever it is out without having to make any surgical incisions. Okay, an example of changing a cast, application of compression stockings to increase circulation, falls under dressing. Let's see here. Excuse me. Placement of a cast on a sprained ankle, packing a nasal cavity, removal of urinary catheter. So if they're changing one of those, these are all some really good examples here, but they've given us some examples on all of these. Okay, so let's take this first one. We're changing a cast on a non-displaced fractured arm. Okay, so the first thing we do is we say it's placement because we are placing a cast onto the body, and so we start off our code with the 2 for placement. Our next thing is the fact that is it an orifice or is it an anatomical region? And for the arm, it is going to be an anatomical region. And I can go in here in my table and I can see upper extremities or upper arms or lower arms. And so the question would be, do I know where this is at? Okay, if I don't know where it's at, can I say upper or lower arm, or do I have to say upper extremity? That's an important question to ask yourself. And in this case, they didn't even tell us which side. So this would be an opportunity to query the provider and say, hey, I need more information. This is inconsistent because your example here, you said you changed a cast on a non-displaced fracture, but you didn't tell me which arm this was on, so or what part of the arm. So it's very important that you have all the details before you start. Let's say in this case, it was the right radius, okay? So right radius, which is what part of the arm, okay? So if you think about your arm, you have your humerus, and then if you put your arms anatomically, the underneath is your ulna and the top is the radius. So the right radius is over here on the lower part of the arm. So you're going to look for body regions for lower arm right, which is C, okay? Oh, I'm sorry, we changed, or were we changing? Yes, we were changing the cast. So 2, 0, for change, 2W0, Gosh, here I am already messing you guys up. Please excuse that for a moment. 2W0C. And then after that, it is external, and external is the only option we have here. So we're going to put X, device or character. So in this case, we can look through a list of devices. Here we have cast for 2. That seems correct. Double check, make sure it's a cast, not a splint. And then at the end, the only option is Z for no qualifier. Now the next step, of course, is to verify that code. And so you're going to look up the table for 2W0, which is found on the next page, and make sure that this is all correct how you built it. C, 2W0C for lower arm of the right, X for external, 2 for cast, and Z for no qualifier. So that is correct. And that's how, ladies and gents, we build a code. Okay? So let me go ahead and erase some of this here. These are pretty straightforward. I like looking at placements because they're not as difficult as others in order to find exactly what I need. When we get into the medical or surgical section, you're going to find some of these have a little bit more detail in order to find the exact specifics. Okay, so let's look at the next one, which is administration. Okay, administration, if you look in your chapter, to page 433, you have some of the administrations, or I'm sorry, 432, the second character for administration. Yes. Okay, so administration sections use 3 different types. They go either circulatory, indwelling device, or psychological systems and anatomical regions. Okay, so think about that for a second. What is included in circulatory? This is including your heart, all of your veins, and your arteries, everything that circulates through the body. Indwelling devices, this is something that's already in the body, such as a medication that's being administered regularly. Sometimes diabetics may have a device that's doing that. You have some examples here, also psychological systems and anatomical regions. Okay, so you have an example of injection of an antibiotic, putting in or on a cleansing substance. Irrigating of an infected joint. So your transfusion, you're putting in blood or blood products. And transfusing whole bodies into peripheral veins for that one. So just some examples there of your root operations. Your body systems are going to break up just kind of like the same way when you look at these tables. It's very easy to read, and I find that on my book on page 683. There's only 2 tables. This one is so easy. I love it. I can see everything I need to here. And on page 684. So make sure that you look at both of those. Okay, so the first step in determining administration, we know that we're administering something, we're giving it to the patient in some way, shape, or form. So we're going to start with letter, first character is 3. Then we determine where is it at. Is it part of the circulatory? Is it an indwelling device? Or is it psychological systems and anatomical regions? And they have here introduction of a substance or irrigation. Okay, so let's go ahead and use the example of irrigating an infected joint. And let's say it's the right knee, okay? Our right knee is infected. Because of that, we went ahead and irrigated the joint with a... let's see here, an anti-inflammatory substance. Okay, so right knee irrigation for anti-inflammatory. Okay, and while we're at it, we'll also do an let's do 2 of them here. We'll do an anti-infective. And oftentimes, it's important that you look up what they're doing based off of the medication they're listing, because they're not going to tell you, hey, this was an anti-infective agent. they're going to tell you the drug or chemical. So I'm going to switch markers here because this one's getting a little loud on us. Okay, this one hopefully will be better. So one of the websites I want to give to you is pdr.net. If anytime that you see a drug or substance that's being given, the physician's desk reference is a great resource for you to look up exactly what is that and what kind of chemical or drug is that classified as, especially when you're looking at agents that are being administered and billed under PCS coding. Okay. So we're getting close to our time here. We want to go ahead and cover these, and then we'll break off into a second part to cover Chapter 25, which goes F, G, H, and X. Okay? So administration of a anti-inflammatory and an anti-infective agent to the right knee through an irrigation. In this case, you're going to have 2 codes, one for each of these, okay? So keep that in mind. Our first one we'll do for our first irrigation here. We're going to say irrigation because the location is psychological systems and anatomical regions. Our second character is going to be E. And our root operation is 1 for irrigation. And this is going to be the same on both codes, so we can build them both together at the same time if it makes sense in our brains and how we're doing things. If you're one of the types of people that has to do it one at a time, there's no wrong way to do this. So make sure you take some time to look at them both. Okay? So our next thing we have to look at is body systems and regions. Where exactly are we sending this irrigation to? So we know it's the right knee. What does that classify under here? We can go in here and look for knee. And you'll notice that knee is not going to be listed. So instead you want to go all the way down to U for joint. Okay? Now notice this doesn't specify which joint. You may look further to see if anything is available, such as our last example where we had upper and lower extremities. But in this case, if joint would be more appropriate than an extremity if that were both listed. Okay? So we're going to put U for joint. Our next is our approach. How did we go in and do this? This one, you're going to have to call the provider and ask them because I don't see this documented here in this example. Okay, so let's say it was an open wound. And they did not need to make an incision of any type. They did not need to take a scope of any type to go through the knee. It was open already. So they fell off their bike, they had a really bad laceration, it got infected, and now they're here to get an irrigation of that open wound of the right knee that is infected, okay? So in that case, since our approach is going to be an open wound, the approach itself is open, and that's going to be 0. Make sure you're putting your lines through your zeros, especially with alphanumeric numbers. You do not want to have a number that looks like an O instead of a 0. Likewise, when you talk about numbers, make sure you're always referring to 0 as 0 and O to O. Okay? Our next section is the substance. And so this is where our codes are going to vary because we have one code here for an anti-inflammatory and one for an anti-infective. Our anti-inflammatory is found under 3. So we'll list that one first. Our anti-infective, is right above that, under 2. Okay? A little dark in the room I'm at. Sometimes your eyes get a little twitchy. When you need to take breaks from coding, make sure to do so. Our last one is the qualifier. And unlike the last example, this one actually makes us look for something. So here, if we look at our qualifiers, we have all kinds of details. We have autologous or influenza vaccine, non-autologous, high dosage of and low dosage of interleukin, brachytherapies, anti-neoplastics, human activated proteins, other thrombolytics. And so you can just kind of read down. Now, other anti-infective versus anti-infective envelope. Since this is an anti-infective for our anti-infective agent, which was the one with the 2, we need to put qualifier 9. Because it doesn't indicate that it's an anti-infective envelope. And if you read through all of the options here, it's not, let's just say that it wasn't given. okay? Or that it didn't meet one of these. Now for the anti-inflammatory, we want to keep reading and see if there's any other codes that would apply. This is one of those points where I always tell my students, guys, read up and down. Always read your tables, your headings, read back and forth. Make sure there's nothing else in the book that you might need. Okay, so I'm going to read all the way down. Nitric acid, other substances, insulins, human B types, hormones, immunostimulators. This isn't an immunostimulator. Immunosuppressants. This is not an immunosuppressant. Antibodies, blood-brain barrier disruptions, gluca, diagnostic, and no qualifier. So after I've read through all of those, if I haven't found what I'm looking for, I can put a Z. I like to throw a little dash on my Z because a Z and a 7 can be very close together in appearance. So I'll go ahead and put that Z there. So now I have two codes. I have the anti-inflammatory and the anti-infective here and here. And both of those would be billed for the administration of each of those services. Okay, so we have one more, which is talking about measurement and monitoring. And these are going to be some of your services that you're providing to typically diagnose. And keep in mind, a lot of times one of your qualifiers will ask if something is being diagnosed. And if it is, you want to make sure that you indicate that in your code. Always pay attention to that, okay? Especially with measurements and monitoring, because a lot of times you're looking at diagnosis services. Okay? There we go. It can be known as a default, that unless it's indicated to you as treatment purposes or routine, which you won't see in the facility base, that it is a diagnostic test. So keep that in mind as well. All right, so we're going to go ahead and look in our book here at measurement and monitoring. Okay, so some common root operations for these are psychological systems versus psychological devices. Okay, and they give us some examples here. Measurement, which starts with 0. Measurement is determining the level of psychological or physical function at a point of time. Okay, keyword there, point of time. Monitoring is determining the level of psychological or physical function repetitively over a period of time. So your keyword between measurement and monitoring, what is it now? What is it after I've watched it for a while? Okay? So if it's one test at one time, it's measurement, but if it's a test that extends over a period of time, it's going to fall under monitoring. Okay? And so we're going to go ahead and flip over to section 4 in our PCS book here. Measurement and monitoring. I find this on page 697, and you'll notice that your entire table for both sections is all on one page. I really love that about these small sections in the back. Makes it a lot easier to build together codes. Okay, so you have psychological systems, which break down measurement and monitoring, and have body systems based off of nervous systems, nervous systems break down the different types, the different body areas, and then you have psychological devices based off of where it's at. Okay, so systems versus devices. And here you also have a function and device values of measurement and monitoring. Which if your devices measure the movement and flow, electricity, metabolism, pressure, and temperature, devices include the stimulator, pacemaker, and defibrillator. And there is a table on 21.8 that gives you a list of functions and device values. So if you're trying to determine, is this a device, take a look at that. Make sure that you reference it if your book, if you want, you can tear it out of your book, you can copy it, whatever is easiest for you. Okay, so where's our examples here? Okay, so we have an example here, sampling and pressure measurement in the left heart done via catheterization, determining cardiac electrical activity with an EKG, manometry of an organ, which is pressure measurement, and then your other one, monitoring, determining the level of psychological or Okay, we already read through that. Example is fetal heart monitoring, gastrointestinal motility monitoring. So we got those two examples in here. Let's choose the second one. We have the fetal heart monitoring, gastrointestinal motility monitoring. So here we have the terms already kind of embedded in our technology here, that these are going to be for monitoring. The question is, this one's kind of cool because we're talking about what's called products of conception. So we're going to say we have a fetal monitoring. And what are they monitoring? This example was heart monitoring. So they're looking at the baby's heart and gastrointestinal motility. Okay, so if we look over at our table here, we know that we're going to start with 4. And we have the difference of 4A0 versus 4B0. And so we need to look at A versus B, which is the difference between systems and devices, okay? So in this case, this is not a device used for monitoring. And you'll notice with devices, only measurement is listed. Monitoring is not. Okay, so we're going to be 4A. And then we say, is it measurement or monitoring? It's actually monitoring, which is 1. Our body systems, we're going to look at for character 4, is going to be considered a very scientific term, products of conception. And if you look at this, we have 2 different options for products of conception. We have cardiac and nervous. Okay, so we're going to go under H for cardiac. Okay, approach. Well, what did the doctors say? They said they went in with a scope through a vaginal opening. That's going to be the most common. Or they may have done they may do that, or they may do an external. If, say, they're looking at, and most likely they're going to be doing this external one here, if they're looking with an ultrasound or a device on the baby's, on the belly of the mom to hear the baby's heartbeat. So in this case, this one would be external for fetal monitoring. Let's go ahead and put X. The function of the device here, and we have a whole bunch of different listings. In this case, what are we monitoring? We're looking at the fetal heart monitoring. So that's probably going to be rate. We would definitely look at the documentation to see what it states. What are we monitoring about the heart? So there might be rate, it might be rhythm, it might be something a little bit more. Most commonly is the fetal heart rate. So we'll put C for heart rate. And then our last one, which is our qualifier. And again, we're going to look up and down. Sometimes these won't always apply. So in the example of products of conception, we may not have any catheter, or I'm sorry, any qualifier here. So this one, I'm going to take you next. We built this off the first table, but let's look specifically at 4A1. So if we move on a couple of pages to 4A1, we'll find in my book on page 700 as well as 701. Keep in mind, sometimes tables will repeat, and so you'll see a little notation of continued at the top. It's important to look at both pages because sometimes it will repeat with different instances, and it can get you really lost. Okay, so I have 4A1, and I already determined that I had, my next character was H, which is going to be found on page 701 for products of conception. And here, they've broken down the next options after H. So the only options were natural or artificial opening, endoscopic or without endoscopic, or external. And so we can see that the X that we listed was correct here. And we continue on. We had electrical activity, rate, rhythm, and sound. So if they did more than one thing in that fetal monitoring, we're going to list one for each. Notice how this is a lot smaller of a list in our character 6 options when we go to the specific table. So for this purpose, it was actually a little easier, not knowing all the details of the example. But if you had your actual note in front of you, you would have gone over what were we looking at, what was the details. So we had C for rate. And you notice how this one gave us no qualifier at all. So even though in the first part of the table, the overview gave me all kinds of qualifiers, some of those don't always apply to every option. So this one was a great example. All right, that's it that we have for Chapter 21. Go ahead and wait for the video to pause or click on the next video to talk a little bit about our other sections of Learning Module 2, which are characters for F, G, H, and X. Thanks, guys. We'll talk to you in a minute.